Hi everyone, welcome to lesson 2, video number 2 in the BioTap Principles, Touch, Balance, and Attunement Techniques video series or lesson series that I'm doing for everyone. I thought I would take some of the downtime that we're having with our mandated stay-at-home orders here in Brooksville, Florida, to create some new educational materials. So right here in lesson 2, we're picking up where we left off in lesson 1. We're on page 15 in the BioTap or BET manual. Just a reminder, if you don't have this manual, it's either in your student Dropbox as a SomaVeda Thai Yoga Practitioner Program graduate, or it's in the LearnThaiYoga.teachable clinical guidelines course in the appropriate section for those of you who are in our monthly subscription program. We teach this in every class, just a reminder. All right, so let's get to it. All right, common uses for SomaVeda BioTap or BET. So individuals who've not received the help and healing they previously thought the mainstream medical, psychological, or drug-based industry would give them are finally able to take charge of their own healing process. Yoga therapists are integrating this practice in their sessions and routinely teaching the process to their clients for use at home. Now, that's one of the beautiful parts about this is you can do this with other people as a therapist or as a minister or practitioner, and you can teach your patients, clients, fellow church members, communicants, how to do this methodology to help themselves and to help their own family, their children, their relatives, and so on and so forth. Teachers are learning to use it for their students. Coaches are learning to use it with athletes. It's actually been researched that tapping can be a performance-enhancing therapy. Parents are learning it for use for themselves and with their children. Especially helpful with children who are having some learning disabilities or social anxiety types of disabilities, or children who are recovering from PTSD and or other kinds of injury. Physicians of all kinds are learning it for pain management with their patients. Massage practitioners are blending it with their existing procedures for longer and more lasting results. Although, sidebar here, in many licensed massage therapy jurisdictions, tapping with clients on emotional or psychological issues is outside scope of practice and would be a violation of your Massage License Act. So I would recommend, if you're one of those people, that you go back and review your scope of practice under the state massage license. Spiritual leaders are applying it for their own issues and to those in need. In fact, in my opinion, if you're a minister today and you don't know the equivalent of BET or EFT or TFT or one of the other tapping methods, this one or one of the others, you're behind the times. I believe all ministers should know how to work through old, unresolved, negative emotional issues with their parishioners. That includes Native American practitioners. Oh my God, Native Americans have a long history of trauma, and many, many Native Americans have even multi-generational symptoms of PTSD. So this is really called for in Native American communities. Chiropractors, acupuncturists, homeopathy practitioners are augmenting their practices and teaching it to patients for self-use. That basically, if you want your client, your patient, to be in charge of and capable of continuing to make progress in their internal fitness, internal wellness, internal resolution of old issues that are blocking their ability to have a happy, successful, functional, and practically growing life, that you want to give them this as one of the skill set. Now, let's talk about side effects just for a second. We don't know how many SomaVeda BioTap BET or EFT tapping enthusiasts are now using these procedures on behalf of others. But I could easily estimate that it exceeds hundred thousands and has probably been applied to over 1 million times worldwide. This wouldn't happen, of course, unless substantial results were being received, and 2, perceived dangers or negative side effects were minimal. While no experienced SomaVeda BioTap style practitioner can deny seeing substantial results, not everyone is aware that there can be negative side effects, sometimes severe. Let me explain. Some people have been so badly traumatized and or abused in their lifetimes that they have developed severe psychological problems such as multiple personalities, paranoia, schizophrenia, and other serious mental disorders. While SomaVeda BioTap, BET and its cousins have been helpful in such severe cases, that's a fact. In these instances, it should be applied by a qualified professional with experience in these disorders. In no case, let me repeat, in no case can we recommend this or any treatment or therapy against the advice of a licensed physician. Any under the care of a medical doctor, physician, psychiatrist must be recommended to consult with their physician before beginning any course of therapy. Why? First of all, because that's the law, and it's also a law of common sense. Secondly, because some of these patients experience bad reactions, and whereby they go out of control. During healing crisis, it's possible that they could be harmful to themselves and to others and may need to be sedated or hospitalized. And in fact, I have had at least one case where I recommended that a client who lost it completely during a session and became violent, that they were Baker acted and that they were incarcerated for a couple of days to be assessed psychologically and also somewhat medicated. This is obviously no place for the novice, no matter how enthusiastic one might be for the tapping procedures. And the place I'm talking about is with severely affected, psychologically disturbed individuals that might be a danger to themselves or to others. Incidentally, we don't know yet whether tapping actually causes such side effects or bad reactions, or if it's just the memory of one's troublesome issues that precipitates such problems. Nonetheless, if you have no experience in these areas, please don't go where you don't belong. Okay, that's my advice as your teacher. That's my advice as a trained physician. How often do these bad reactions happen, or these abreactions? In a psychiatric care or hospital, they're common. Yep, they're actually common, everyday occurrence. In everyday society, they are rare. In my own experience and in consulting with both my own students and other professionals that have dealt with a wide variety of emotional problems, such as severe abreaction, this 1,000 clients have experienced, let's say it again. A wide variety of emotional problems, we have seen less than 1 in 1,000 clients who have experienced a severe abreaction. This minimal percentage is given for perspective only. It is not to suggest that SomaVeda BioTap or BET practitioners should play the odds and go where they don't belong. In other words, take a chance. On the contrary, a novice practitioner or other holistic practitioner of any kind should use common sense and not try to alleviate or cure ailments that are beyond their capacity or their training. And of course, how do you know if this is beyond your scope of training? Well, if you doubt your capacity to work with a specific individual or a specific condition or concern, then refer it out. Don't wing it. In other words, don't do it. If you have to ask the question, is this something that is beyond my training, my experience, or my capacity to serve well, then don't do it. Get an opinion, get somebody else involved who knows more than you. Again, I'm simply urging using common sense approach for both your safety and legality as a practitioner for the safety and integrity of your client. Okay, however, having said the aforementioned, common cause contraindications in mind, common sense contraindications in mind, as the founder of the related EFT technique, Gary Craig, states, try it on everything. What are the issues with regard to practicing or experimenting with SomaVeda BioTap on yourself for your personal issues? Well, you have every right and authority to experiment and work on yourself without necessity of having any external authority to give you permission to do so. Let's go to page 15. Common uses for SomaVeda BioTap, BET. Individuals, well, I think we went over this, didn't we? Okay, let's keep going. Page 16, we did side effects and our agreement. According to the following common statements, constitute a legal agreement between us. In other words, read these statements carefully because they constitute a legal agreement if you're going to practice what I'm teaching you. This material takes the form of a thorough discussion, explanation, and demonstration of a very impressive personal improvement tool. It is not a training program in psychology or psychotherapy. All right, it's subject to other provisions of this agreement. You may use SomaVeda BioTap on behalf of yourself or for others. NAIC Inc., SomaVeda College of Natural Medicine, Thai Yoga Center, Anthony B. James, Meta Journal Press, our authorized representatives or teachers cannot and will not take responsibility for what you do with these techniques. Accordingly, you're required to take complete responsibility for your own emotional and physical well-being both during and after studying this material. You're also required to instruct others whom you help with SomaVeda BioTap or whom you teach SomaVeda BioTap to take complete responsibility for their emotional and or physical well-being at all times. So you must agree to hold harmless anyone involved with SomaVeda BioTap from any claims made by anyone whom you seek to help with biotapping or to whom you teach biotapping. Okay, well, we live in America in the 21st century. We have to go over informed consent, waivers, and disclaimers. The last one is we urge you to use these techniques under the supervision of a qualified practitioner, therapist, or physician. So if you're not a qualified practitioner, therapist, or physician, certified and or licensed to practice these techniques, whether by us or some other organization, then you need to make sure someone more knowledgeable than you is involved somewhere in your loop. Don't use these techniques to try and solve a problem where your common sense would tell you it's not appropriate. If you don't agree with the foregoing or can't comply, please give notice and withdraw yourself from this training immediately. Otherwise, we have an agreement and I expect you to abide by it. I do everything I can to abide by my agreements. Pretty much I expect you to do the same thing. Okay, enough of the informed consent waivers. Page 21. What are biotransformational technologies? Because BET, tapping, EFT, TFT are biotransformational technologies. They are tools and technologies for adapting, reorganizing, balancing, healing, transforming, and liberating the human biological machine. We define people, ourselves, as stress-adaptive electrobiological organisms, i.e. machines. As such, we're developed, shaped, and organized by and according to various stressors. All right, let me say this one more time, okay? In SomaVeda, we defined ourselves as stress-adaptive electrobiological organisms, i.e. machines. As such, we're developed, shaped, and organized by and according to various stressors. So, as stress-adaptive organisms, we define ourselves. We have to have stress to grow. How about that? But within margins. Too little, too much, and we don't grow. We don't function as we should. What are the stresses that cause either healthy or unhealthy adaptation? These stresses are A, stress built into the machine itself, tension or the machine's own internal resistance to simply being alive. Some people have described this tension as Even antagonistic muscle tension, like the difference between the bicep and the tricep and how they work, and one tensing, one relaxing, the other relaxing, the other tensing, and the result of this stress tension modification from the anterior to the posterior of the arm, we're able to bend and move and extend our arm, and are able to lift, and are able to reach over here and grab our coffee cup. However, there are other internal stressors. B, stress from cultural programming. Pressure to function, to conform, to fit in, regardless of appropriateness or suitability for individual composition. All of us struggle against this. Every human being. This is the cultural programming that first comes from our family, from our schools, and now in this corona environment epoch, we are having to conform to social constricture, stay-at-home orders, quarantine, and these things cause stress, and we adapt to them whether we like it or not. Acculturation is stressful in that normal familial and societal pressure takes into consideration little or nothing relating to the specific individual's design, makeup, personal limitations, and strengths, including those under personal inclination. Cultural program is actually opposed to individual personal expression and treats all such as aberrations, even to the point of trying to isolate or destroy machines operating too far out of the norm. Okay? Let me give you one example. Genetically, biologically, you're born a male or a female. You're determined to be such based on the appearance of external primary and secondary sexual characteristics, i.e., do you have a penis, do you have a vagina? These external physical attributes are so ingrained and so carved in stone that you are declared to be whatever your genitalia indicate that you are, regardless of the fact that genetically and other criteria that you may not be clearly a male or a female, but in fact may be expressing gender on a continuum of expression which your family, religion, church, culture, society may not even admit exist. In other words, is male or female, there's no continuum between male and female. Of course, scientifically, we know that there is a continuum. The strict adherence to acculturation, familial, societal, educational, governmental, and so on, religious, ecclesiastical, the difference between those standards, which are arbitrary external, and your actual way of being in your physical tissue, in your mind, and in your spirit, and in your heart, causes stress. And we are constantly adapting to this stress. This is especially true for individuals who elect to engage in activities designed to awaken or to transform the personal machine. Why? Because all such efforts and systems are outside of some norm. All right, page 22 and 23. The stressors, when negative, lend themselves to creating a state or condition or biopathy with primary symptoms of sympathetic atonia. The efforts to make the body a more functional apparatus for transformation and expression of vital life energies and their corresponding positive emotional states such as love, compassion, equanimity, and joy without bias or discrimination are healthy and cause healthy adaptations. So I mentioned a biopathy as a negative adaptation, as a maladaptation to stress. So let's get into this just for a second. What's a biopathy? Biopathy is a contracture of the organism's matrix and the TPB, or tangible physical body, emphasizing sympathetic nervous action dominance and activity, i.e. sympathetic atonia. I might get into this later, but that term, sympathetic atonia, was coined by Dr. Wilhelm Reich, actually in the late 1920s. What are the symptoms of biopathy? Psyche symptoms are negative fear, phobia, anxiety, general loss of conscious control of mind and emotions, and a spiral of deterioration. Concentric, we break this down into several different forms of these symptoms, if you will. A, concentric movement and rigidity of physical postural attitude, i.e. spasm. B, stiffness and flexibility of mind and mental process. So let's talk about, again, these different types of psyche symptoms and their categories. A, concentric movement and rigidity of physical and or postural attitude. Concentric, shortening, as in a defensive reflex. Stiffness and flexibility of mind and mental process. So if A is inflexibility, tension, spasm of physical and postural attitude, B is stiffness and flexibility of mind and mental process. C is reflexive conditioning and progressive submission to negative and increasingly negative thoughts and thought patterns. D is development of armoring and conditioned localized spasm forming both local areas of rigidity and corporately generalized loss of functions in circulation and life force. Prana, chi, orgone, as well as actual circulation of vital substances of the body, i.e. fluids, secretions, oxygen, lymphatic and interstitial, and a corresponding increase in edema, stagnation, and a proportional atrophy of first local area tissue, then general deterioration of the entire system. Oh my God, how many illnesses or not well conditions, diseases, syndromes could fit into this D category? It's a rhetorical question. Almost all of them could be. Energetically, may be evidenced by imbalance and discord in the matrix or energetic body, seen as discord in dosha, chakra, sen, and nadi. See there I'm using the Ayurvedic terms and also relating to koshas, or the 5 different bodies. So if we could say there's a biopathy for each of the 5 koshas. Hyper and hyposensitivity of lom, Thai word lom for marma. Points in general. Marma is Ayurvedic points and lines, nadi and or Thai sen lines. Restrictions and inability to assume asana and distortions of asana in practice, as well as in reduced ability to perform common and ordinary tasks. You know, as a human being, there's a certain amount of work, a certain amount of expression of character and expression of life and movement, range of motion, if you will, that we are designed to have structurally the entire length and span of our normal life, a certain degree of functionality. And to lose that functionality and the ability to express that functionality prematurely is actually biopathy. It's actually a symptom of a disorder. This includes efforts to do just about anything within a normal course of life would be or seem to be more difficult. This difficulty could be mental, emotional, or physical. You want to understand this. Energy imbalances are physical imbalances. Physical imbalances are mental imbalances. Energy imbalances are emotional, psychological imbalances. Emotional, psychological imbalances are physical imbalances. Lastly, F, complex symptomology. Symptoms can also be combined in the sense of the bioemotional, biophysical, biopsychic, bioenergetic, and biosexual manifestations may occur in either sequence or all at once in varying degrees. So you can have one of these, you can have some of these, you can have all of these all at the same time, right to the last breath that you draw in your life. It's both the good news and the bad news, because as long as there's breath, there is the possibility of remediation and to make progress in resolving the biopathy. Okay? Currently, let's talk about our developmental plateau on page 25. Currently, we've reached an evolutionary hiatus or plateau. Previously, there may have been some progress toward evolution in our species. However, up to this point, it was mechanistic evolution. According to this system's way of thinking, we are still inherently no different than the progenitors of our species, the Neanderthal. The bulk of daily human life concerns and activities are basically the same: security, survival, procreation, sex, and so forth. Expression of ego and personality as primordial imperatives, so-called inner expressions of love, communication, knowledge, art as secondary, and you might say that some of the outward appearances or aesthetics of life have changed, but have we as a species really changed? So, in my opinion, for the last several thousands of years of biological time, we've achieved a high level of stagnation. Our cultures have modeled our average level of consciousness. Ideas and technologies for expressing our consciousness have not changed. For example, we still solve territorial disputes with yelling, pulling hair, and swinging clubs. Only now we call yelling sophisticated propaganda, marketing, advertisement, spin. We call pulling hair elite surgical strike teams. We call clubs smart bombs. Those among us who perpetuate the most extreme, most insane, and most violent disturbances against the common good, peace, and welfare of the populace are generally those claiming to be spiritual and or moral authorities. Every conceivable horrific act and offense possible to imagine is carried out in the representation of moral, ethical, spiritual, and legal authority. The truth is that the expression of these concepts is directly related to the transformation of the individuals into levels of consciousness. We can say that each machine's activity and expression of higher principles is relative to their level of evolution or alchemy. For example, the concepts expressed as moral, ethical, spiritual, and legal in and of themselves are not lower. However, when expressed and manifested by lower beings in a relative state of consciousness, they take on the quality of the lower consciousness. And then I go on in the book to discuss some alchemy, which actually I'm not going to go into right now. If you want to, again, read the book, I'm not going to cover everything in the book. Two kinds of human beings, very interesting. What kind of man or woman is BE2? BET4, very interesting. Okay, but I will go into this new definition of pain on page 33. Now, we may still use common references such as pain. As a term, pain, for certain qualities of disharmony, imbalance, or state of being, is useful. However, in our proposed new way of understanding, real pain is represented as an impacting interference wave pattern which causes distortion fields in the matrix body and which do not support integration of the awakened consciousness. Simply stated, pain is a certain type or quality of disturbance or distortion in the electrical or electromagnetic field of the body. The distortion field manifests in the machine as negative emotions and all of their infinite diversity of expressions and intensity. The negative emotions are complicating and contributing factors in every form of disease and imbalance of any persistent or chronic nature. But also, I think, in acute nature also. For example, there is some correlation between survival rates, between success rates and mediation rates for all forms of infection and psychological state of depression, for example. The negative emotions are complicating contributing factors in every form of disease. I really believe that. There is an emotional correlation to every long-term, persistent, or chronic illness. I don't care what the name is. There is no difference between so-called chronic physical imbalance or chronic or persistent emotional or mental imbalance apart from the nefarious role of negative emotions. The negative emotions are the symptoms of deeper electrical distortions. You know, even in the DSM, the Diagnostics and Statistical Manual that is used in psychiatry and psychology as a modeling and as a prescription guide for therapy, it's clearly quite stated that it's almost impossible to differentiate so-called psychic or somatic pain and physical pain either way, physical from mental or mental from physical. And then they go to prescribe all the drugs, which clearly don't follow that premise. However, negative emotions are symptoms of deeper electrical distortions. And you know, I'm using that word electrical. I don't know for sure if electrical is the sum of it. My friend and associate, Dr. Jerry Tennant, actually says that there are quantum energy interference, entanglement problems, quantum issues, distortions in fields of plasma, and believe it or not, there is actually plasma in the human body as a phenomenon, and that as close as we can say is the force. So the sum of all of the energies. So not just electrical, because we know now scientifically there are many, many kinds of energies within us. Relating negative emotions, okay, and their diverse expressions as disturbances of the body's electrical fields gives rise to the discovery statement quoted so often by Gary Craig, founder of EFT or Emotional Freedom Technique. And the discovery statement is, the cause of all negative emotions is a disruption in the body's electrical system. Now, like I said, I don't know for sure if there is just a body's electrical system, and that is the sum of cause and effect and the storage of negative emotions. In fact, I believe there's photonic energy in the body, that there is quantum energy in the body, that there's magnetic energy in the body, that there are energies in the body we are yet to have a name for. Okay? However, for now, energy and electrical fields encapsulate the concept and actually work really, really well as terms. So it helps us to keep it simple. Our understanding of what pain is says that pain is the awareness or disruption of the electrical fields in the body, an experience of the negative emotions. The dominance of distortions and disruptions of the body's electrical fields, and the greater deviation from harmonious and harmonic norms equals the loss of functional states. If the body's mission, function, and purpose in this life is to be a vehicle and or to be the human biological transformational machine, apparatus, then it is these distortions which provide the primary impediment to its function. It is these distortion patterns and their harmonic aggregates and the negative emotions they spawn which keep the essence from achieving ascendancy. And when I say harmonic aggregates, there are harmonic aggregates. And harmonics are simply what happens when one energy or one frequency comes into proximity with another or different energy or frequency, and they bang into each other. And as they bang into each other, they create a third frequency, which is a ripple, which is the harmonic. The third frequency, which is incidental to the interaction of the two primary, is also a causative effect. It also can cause effect. So for example, you have water, you have stone. And in my case, I have a really nice flat river stone, which I fling out into the water. When the river stone, which has one frequency, interfaces with the water, which has another frequency, it causes a splash, followed by an expanding ripple. That ripple from a small stone, hypothetically, will travel to the opposite end of the lake, to the bank on the other side. In other words, it diminishes, but it diminishes infinitely and can go forever. Okay? So a lot of the activity, mind, body, spirit, that we see within us and that we're aware of and we're not aware of is actually the interaction of various harmonics and frequencies of energy which are moving within us. Theory of chakras is trying to explain that. Theory of meridians is trying to explain that. Theory of Tai Sin lines is trying to explain that. Five koshas is trying to explain that. Tridosha is trying to explain that. PEMF theories of how pulse electromagnetic field therapies cause beneficial outcomes in the body is trying to explain that. Okay, it is these distortion patterns and their harmonic aggregates and their negative emotion they spawn, which keeps the essence from achieving ascendancy. These negative and dysfunctional states keep the machine completely and blindly in various nap-like states or sleep. Although in the extreme, severe pain can sometimes act as a conscious shock. However, this is not a reliable way to awaken, and as often as not, will leave one heading for the bardo in a confused and disoriented state of mind. And when I use bardo, I'm using a term that's an intermediate state of being described in the Tibetan Book of the Dead as existing between one life or existence and the next. We come together as an expression of affinity patterns because we share attention and frequency of consciousness. Or perhaps it is just we've tried everything else and failed. You would not be drawn to this type of work in healing way unless you've already achieved a certain level of awareness and perception. And this work is invisible to most sleepwalkers, except in the rare exception when they might notice it because it's so irritating. Even the idea of it can be irritating. Now, back to this idea of pain as representing interference fields. Okay. Now, the Buddha said that we live in the world called samsara, or the ordinary world of suffering, and that the arhat, or the enlightened one's objective in life was to conquer the question of suffering. What is the origination of suffering? Where does suffering come from? What are the consequences of suffering? What are the variations of suffering? And how to resolve them. Okay? And in essence, we're still asking those questions about illness, disease, lack of wellness, dysfunction versus function, practical expression of life versus inhibited or inability to express life. And we think that since everything is fundamentally energy, that if we focus on the energy, okay, which is real life, that not only will we become more aware as transforming human beings, but we will become empowered to operate within the natural laws that are being expressed within us and without us. We've always been partners together in the eternal, which now exists as pure form in the realm of energy. And we are together as partners working to solve the riddles of our common existence and manifestation in this material world. We are here together by communion of our common purpose and union of our corporate energetic nature to overcome the limitations of our individual physical selves. More than that, we have help. We are help for one another and all together. One of the secrets of what I call man number 2 is that there may not be many, there may only be one. Within that one is a continuum of expression and variation of frequency. So we are one within ourselves, but we are also a corporate or a common one, striving for integrity, striving for freedom from suffering, striving for liberty, striving for oneness. We work together because we have always worked together. We are each other's eternal bodhisattva or liberating partners and fellow guides. We are our own benevolent deities. We are each other's haruka. We are guides. We are our demons also in many cases. In practice, we're attempting to release the bound up interference patterns and harmonics of their aggregates, as well as the negative emotions entirely from which they come, or which they originate. So in 1,000 ways, Kuan Yin Bodhisattva reaches out with 10,000 lotus hands, each hand representing one dance of liberation, one practical expression of perfected compassion, one technique for the manifestation of awakening, and one step towards the great liberation of the boundless being and true essence. One example is of the joy found in a place where pain is not, the ruler and standard of one's being. One example is of the joy found in a place where pain is not the ruler and standard of one's being, by which life is not defined and interpreted through or by the distorted spectacles of suffering and its infinite variety. Yes, the dance of liberation, to know that we are now and always have been the expression of our own perfect luminosity. So begin to work with this thought. What is now before me is a reflection of my own perfect luminosity. Even though I have this manifestation of my negative emotions, I deeply and completely accept myself. To be in this state is to be in a different place, a different realm of existence and life entirely. This work is Bardo work, and when diligently applied, will provide assistance and support for the journey. And what is the journey? What is the journey? The journey is life. That's the journey. So it is life with illness. It is life with cancer. It is life with diabetes. It is life with heart disease. Yes, it is life with coronavirus. It is life with flu. It is life with just ex-spouses that are hard to get along with. It is life with losing job. It is life with being laid off. It is life with being financially challenged. It is life in all of its variety of expressions. Too full and too hungry, too skinny and too fat, and too sheltered and too open, and all its variations. But we're looking to see if it's possible to find a place where pain is not. We believe that it's achievable, and we can prove it. And the proof is in the pudding, as they say, that if you do this technique, you will see the results. If you do this technique with others who desperately need it and may have tried everything else in the way, drugs, surgery, other psychological therapies, physical therapy, massage therapy, energy balancing, acupuncture, Chinese medicine, Ayurveda, and none of which in and of themselves have actually provided the solution that look like a joy found in a place where pain is not the ruler and standard of one's being, that when you integrate the tapping, you may find that's no longer true. The BioTap technique can be brought into play at any time during any session, as negative emotions or energy disruptions may manifest at any time. In fact, they always do. If you actually kept some kind of a negative emotional journey, a fear and phobia journal, okay, you would find that it's frequent throughout the day. This technique can be brought into play at any time. The basic technique can be done as a standalone session. It can be done before, during, or after a session in an integrated fashion. This is highly recommended as the full SomaVeda program will balance many different issues and aspects for the client and create a nurturing and loving environment. Incidentally, a loving environment is a more trusting environment. This is BT protocol can also be done as an adjunct or non-locally over the phone, for example. We also recommend that you teach it to your client for home use. Emphasize that the client is always in control and responsible for their well-being at all times during this process. It can be stopped or adjusted at any time. You might actually say or use the words, taking responsibility for your own welfare and comfort, or something along those lines. All right, so briefly, I'm going to go over the basic algorithm here, and then that'll be the end of this lesson. Okay, so number one, determine the primary complaint or issue. Try to be as specific as possible. Be alert for underlying issues, which might be more fundamental. Number 2, ask for or generate an index number for severity of the current state or pain. This should be a number between 0 and 10, with 0 being little or no symptom, and 10 being more than they can bear or severely acute. Number 3, excuse me. Number 3, start with light rubbing of the setup point for psychological reversal, the sore point or karate chop point right here, okay, and recite the organizing statement. Even though I have this, fill in the blanks, I deeply and completely accept myself. Even though I have this, okay, fear of corona, I deeply and completely accept myself. Even though I have a fear of getting sick and dying from coronavirus, I deeply and completely accept myself, etc. Whatever is the issue right now. You can adjust or change the statement to better suit yourself or the client. Then do the basic algorithm, do the hand points algorithm, do the 9 gamut set algorithm, reassess and see if the index number has improved. If the complaint is resolved, either you're done or move on to another issue. If the primary complaint is not resolved, or if another complaint or issue has surfaced in its place, then go back and repeat steps 2, 3, and 4, perhaps substituting the words, even though, see I already tapped on my fear of getting sick with coronavirus, even though I still have this fear of getting sick from coronavirus, I deeply and completely accept myself, and then repeat as often as necessary. Now I want to say this, the exact words that you use, okay, in the statement, use them the way the client says them, or use them the way that they appear in your head. Don't clean them up. Don't socially PR, edit, or censor the words that the client's using or that you're using in your head. For example, if in your head you know that your fear of getting sick is irrational, you might say something like, even though I have this stupid fear, okay? Well, if you're tapping with someone, don't censor, edit, or remove the word stupid. In other words, part of how this works is that we want to acknowledge the issue the way the issue manifests in our head. And if that word stupid's in that declarative statement, then you want to use that word. All right, now let's go real quick to the points, okay? And right here, I've got 9 points if we include the setup point, okay? All right, number 1 is inside eye or over the eye, okay, over the inside corner of the eye, okay. Number 2 is outside corner or beside the eye, BE. Number 3 is under the eye. Number 4 is under the nose or on the maxilla, UN. Number 5 is under the mouth, okay, on the front of the ramus, okay, UM. Number 6 is collarbone point. And number 7 is the side point just lateral of the lower breast under the arm, okay, right here. Now, in this chart, I've given you both the acupuncture names or point values and their traditional names for all of the points. For example, 1 is bladder 2, zangshu, or gathered bamboo. Number 2 is gallbladder 1, tangjia lao, or pupil stream. And what you can do is you can go online and you can look at an acupuncture atlas, and you can look up the Chinese acupuncture point that we're actually tapping on, and you can find out more about it, because every one of these points has a lot of information. They're crossover points. They relate to other meridians. They relate to specific organs, for example, bladder versus spleen or stomach, okay? So you can look these up and you can get a little more of an idea of why these points were selected. Now, before I close out this lesson, I will tell you one more thing about why these particular points were selected. First of all, how many acupuncture points are there? And you look on an acupuncture chart and you'll see 364. Okay, is that all the acupuncture points? Answer is no. Why? Those are only for 12 meridians, primary, and 2 extraordinary meridians, conception and governing vessel. Okay. However, how many meridians are there? Well, there's at least 72. How many points are there? There's at least 10,000, and there's speculation there's more than that. To be an acupuncture doctor, like the program that I went through, I had to learn over 700 points of these points. I had to learn over 700 of them and how to put a needle in them, how to treat them, and then different algorithms on how to use them based on assessments which were based on pulse and other observations. Very complex, took a long time, okay? However, over and over and over and over again, many of us realized that we weren't using 10,000 points. We weren't using 700 points. In fact, we were hardly even using 100 points. And actually, for most illnesses, we were only using about 20 points, maybe 30 tops. And so there were many points that were shared between many traditional treatments for many traditionally categorized illnesses. And so the idea was, it came back down to, you know what? To be functional, you don't have to learn all the acupuncture points. You don't have to learn everything about acupuncture. The Thais did the same thing, only they're a crossover between acupuncture and Ayurveda. And the points are called marma. And how many marma points are there? Well, there's 300,000. How many energy lines are there? 88,000. Okay, so who can do a treatment of balance 88,000 lines and a couple of 100,000 points? It would take not even your whole rest of your life to work on one person one time. So that's not going to work. So in reality, in Ayurveda and Marma Sakitsa and Kaya Sakitsa, we don't work 1,000 points, 1,000 marma. We don't even work 100 marma. We work about the top 20 marma, and we address major chakra, which are called lom in Thai. Chakra are the big ones, lom are the secondaries, marma are the tertiaries on the energy lines. And what we did here in this tapping algorithm, we actually took the most commonly affected or indicated points for the most common psychological, emotional, and energetic disturbances that also related to other meridians like crossover points, and we simplified the system. So now we only have to know essentially, to start with, about 8 points. Okay? Now I didn't go over the setup point or the do before point right here, which is between the first and second rib, just lateral of the rib heads, and you push in here until you find a distinctively sore point, and that's why we call that sometimes the sore point, and just circle there. And this point is useful for psychological reversal. Okay, you can use the 9 gamut point too, but actually I like to alternate, and I will use this point first. Psychological reversal is you have an issue, you know you have an issue, you're affected by an old unresolved negative emotional issue, fear, phobia, or so on. You know that, you really wish that you weren't, it affects your life negatively, maybe even incapacitates or cripples your life, but you are incapable of doing anything to change it. It could be as simple as stopping smoking. You know you need to stop smoking. You know smoking is bad for you. You've read all the research. You're doing nutrition and trace minerals and so on to handle biologic issues of withdrawal symptoms, but you just want to smoke because you just like to smoke. It's serving you in some way. You're psychological reversed to quitting smoking. So again, we're still calling that an energy issue, which can be balanced. So if we turn it off, Okay, in other words, like an electrician would turn the light off and it's no longer shining. Okay, if we turn it off, we get a little window there that we can reset the system through using a tapping algorithm. All right, I hope that that's helpful for you in trying to understand this. All right, that concludes lesson number 2. We'll pick up on page 40 on lesson number 3. God bless, stay healthy, take care of yourself, take care of everyone around you to the best of your ability as part of your health maintenance plan, as part of your mental health plan. That's what I'm doing. It's working for me. I highly recommend it for you. Thank you. Have a great day.